Get ready with me while I share some tips and tricks that helped me as a first-year nursing student for other first-year nursing students out there. Some advice that I got from some other students and teaching staff when I first started was to be proactive in clinical placements. This is the thing that kind of everyone says, but you only get out what you put in. So that's taking initiative to assist with tasks and practicing your skills. It's also engaging with patients to gain more experience and learning about their past and kind of piecing together their stories to help with your learning. The more experience that you have, the more confidence that you'll gain. Nursing is filled with so many ups and downs, but it does get better. It may seem so hard and it may seem so daunting and scary at the start, but it definitely does get better. One of the most important things that I've learned from not having it in the start is to build a strong support system. So whether that's other students who understand the same challenges that you're going through, whether it's family, friends, just making sure that you have other people to support you and to talk to when you are struggling. I would say stay curious. Don't just study for the sake of the exam or for the sake of the content. Do it for yourself. The more interested that you become in a topic, the easier it will become to revise. It's really important that you pace yourself and that you don't become discouraged by the workload. It is important that you stay consistent with something like a study schedule to make sure that you're staying on top of everything and not being left in the dust. When you're on placement and a nurse offers you a task, don't turn it down. Even if you are terrified of completing whatever task it may be, it is really good for learning experiences. Obviously, as long as you're staying within your placement guidelines and you're within your scope of practice. Because at the end of the day, the nurses that you're with on placement are there to help you learn. They want to help you learn. That leads me on to my next thing, is be open to feedback. Constructive criticism is vital to your education and improving your skills. If you're not gaining any feedback, any criticism, how are you meant to know if you're not doing well? If there are better ways to do it, easier ways? It's something that's so simple but so important in your learning. Don't be afraid to ask the silly or stupid questions, because majority of the time there's someone else in the room that will be asking the exact same question, wondering the exact same thing. If you have any other tips or tricks that you think would be really useful for any other nursing students, or ones that you found particularly useful, please do share them in the comments. Everyone is still learning, so tips and tricks can always be useful no matter what stage you're at. Now we're all ready to head off to uni for the day.